ultrasound and the skeletal anatomy relevant for the elbow joint injection. To perform the elbow joint injection, the starting point will be to put the ultrasound probe on the top of the muscle in the posterior aspect of the joint and moving the ultrasound probe down looking for the olecranon. Once you've found the olecranon process, then your aim would be to move the ultrasound probe laterally and aiming it, the proximal end of the probe will be heading medially, and you'll be looking for a V-shaped gap which will be the entrance to the elbow joint. And the important skeletal landmarks here is you'll be able to see the trochlea, be able to see the olecranon, and you'll also be able to see the entrance to the joint. Using an in-plane technique, the joint injection will be performed, and the probe position will be like this, where you have olecranon, lateral trochlea of the humerus, and the in-plane technique, needle coming in, going into the elbow joint. Thank you. So we're going to talk about the ultrasound-guided elbow joint injection. The position of the patient is very important, especially for this particular injection, where you want the elbow to be flexed around 90 to 100 degrees with the arm resting on the patient's thigh. If you have the elbow in the extended position, the joint will be closed. It will be difficult to get the access to the joint. Hence, keeping this position will allow the optimum opening of the joint and the access to the joint. The next structure to palpate will be the olecranon process, and you will put your ultrasound probe on the top of the olecranon process, and you'll be able to see the tricep muscle attached. Once you have got this picture, the next step would be trying to move the proximal end of the probe towards the little finger of the patient and trying to look at the trochlea of the humerus, giving you an access to the elbow joint. And here we have the access to the elbow joint. I'm going to show you the structures, the tricep muscle, the olecranon process, the trochlea of the humerus, and you can then bring the needle in plane, getting into this V-shaped space, which is the access to the elbow joint. So the in-plane technique, bringing the needle from proximal to distal, trying to get into the joint. About 2 to 3 cc's of local anesthetic and steroid mixture should suffice this injection.